Dr. Dustin Weiss is a vascular surgeon with North Central Heart in Sioux Falls who helps with vascular problems. One problem he helps with is venous disease, or varicose veins.
So venous disease has a wide spectrum from just very mild spider veins to progress to varicose veins to swelling, and some patients will even get skin changes with darkened hyperpigmented skin and thickened skin, or even progress to ulcers.
Dr. Weiss says that veins in your legs have the hard job of bringing the blood back to your heart. So if someone is standing, the valves prevent blood from flowing backwards and pooling in your legs. With venous disease, those valves don't work like they should, causing pressure in the veins.
So it's just like if I had a garden hose and I held it 10 feet in there and it's full of water, it's going to be higher pressure at the bottom. So if those valves in the superficial veins don't work, what happens then is the branches, there gets to be high pressure, and then those branches get big and dilated, which then cause the varicose veins, and also can cause swelling.
Genetics, age, and blood clots can play a factor in developing varicose veins, as well as people who stand or sit for long stretches.
And then we also see it more commonly in people that, on their feet for long periods of time, or sitting for long periods of time with their feet in a dependent position.
But Dr. Weiss says there are no risk factors that could lead to venous disease. If someone develops the disease, the first step in combating it is compression socks.
So the first treatment is to push the blood flow out of those superficial veins and into the deep veins, and that's why we use compression socks. So the first time we'll see patients, we'll have them wear compression socks, which helps push the blood flow into that deep vein, and often will help with the symptoms.
Other things patients can do are to lift their feet in the air when relaxing and make sure to sleep in a bed rather than a recliner. If the compression socks aren't working, Dr. Weiss says some surgeries are offered to help fight the disease.
If the veins themselves are big and dilated, the varicose veins, but there is not vein reflux, meaning that the valves work fine in your veins, then we can do either injections, like sclerotherapy is called, or microthrombectomy, which are small incisions, and we actually remove those varicose veins.
Overall, Dr. Weiss says if varicose veins start to develop, getting compression socks should be the first thing to do.
If you have symptoms of varicose veins, the compression stockings are important to help with those symptoms. But then if we do have patients that develop severe disease and have ulcers, then the compression is needed for them to heal up.